Welcome to Make America Healthy. My name is Beth Shaw. I'm the host of this show, and we have the goal at Make America Healthy to educate you, empower you, and inspire you to take better control of your own physical and mental health. So, we are very happy today to discuss stem cells. So, you may have heard of stem cells. Some people get them injected in their joints, other people have them injected in their face. Some people have them injected for sexual wellness. And we are joined today by Dr. Jeffrey Gross, and he is a graduate of University of California, Berkeley. He went on to work at George Washington University, Irvine Medical Center. He's got a super long bio, and he's been recognized as a leading neurological surgeon and has won many awards. He founded, which is an anti-aging medical practice in the Las Vegas area. And we're going to learn today all about stem cells. Dr. Jeff, welcome to Make America Healthy.
Thank you so much for having me. It's my pleasure.
Yeah, I've been around the longevity world and anti-aging for a while now for professional and personal reasons, of course. I've had a little bit of experience with stem cells, not so much. I've had friends that have had them injected into their knees for different issues and into their back. Just give us an overview of stem cells and what they're all about, what they're used for, and how they may help some of our listeners.
Sure, happy to do. We'll do a little stem cell 101. So when we use the word or the phrase stem cells, we're really talking about regenerative medicine, which taps back into our own blueprint, our own DNA to heal and repair like we did when we were more youthful, like a child who heals quickly, or when we were growing and developing and turning over cells quickly. As we age, we don't turn over those cells quickly. We get stuck with these senescent zombie cells that don't function well and create inflammation, and inflammation creates disease and accelerates aging. So tapping back into regenerative medicine is learned from observing our own stem cells that we retain even into our elder years that are designed to help replace and renew and heal, help us heal things and fight inflammation for that matter. As it turns out, there are multiple levels of stem cell type biologics that you can receive or you may have heard about. The lowest level is called platelet-rich plasma, or PRP, and that's often used in many clinics for joint pain and tendinitis. There are cosmetic and uses for vampire facial or
I had one of those.
thinning hair or sexual function. The next level up is stem cells themselves, and those can come from your own body or from a more youthful donor, like the umbilical cord after a woman has a baby. Usually by C-section, they can be, for that purpose, donate, and they're made available. But more recently, over the last 6-7 years, we found out that if you get stem cells put in your body, they only last about 10 to 14 days. But the benefits last much longer, maybe weeks and months. And the reason for that is the stem cells you get really aren't doing all the work. They are producing and delivering small signaling bodies called extracellular vesicles, or for short, exosomes. And these exosomes are better at penetrating tissue and getting into the body, crossing the blood-brain barrier to get to the nervous system. They last longer, and they're doing the actual work. So now we can just skip the delivery mechanism, the stem cell, and go right to the exosomes, which are made available to us here in the US from donors. Exosomes don't carry much DNA, if any. They carry more growth factors and proteins to fight inflammation and help put your cells back in a restorative, youthful, healing, anti-inflammatory mode. And also, they're much less expensive than the cells.
Thank you for all. That's a lot. A couple of things. As I stay longer on the planet, have thought about doing stem cells for my face, for my skin, for a knee that's bothering me. But I have some friends that are very spiritually minded, and they said when you inject stem cells that came from the placenta, for example, you are taking into your being other people's DNA. And with that, you could be taking on other people's generational trauma. Someone said you could have flashbacks that are not even your own. For my friends that have avoided vaccinations, if the person who donates these stem cells was vaccinated, are they going to be bringing that into their bodies and their DNA blueprint? Educate us a little bit more on the nuances of this, the benefits as well as the downside.
One of the reasons that I'm less in love with stem cells and more in love with exosomes, both for the many reasons I listed, and we really don't want other people's DNA necessarily. Now, having said that, there are micro DNA all around us in the air. You live with someone, maybe a spouse for 30, 40 years, and you actually have some what's called chimerism, where you have shared DNA all those years, in just from talking next to each other or sleeping next to each other. So we do share DNA in the environment, knowingly, unwillingly, it just happens. But having a dose of cells is a bigger dose of DNA, and it can get into your cells and change your makeup. That certainly can influence your blueprint and your machinery of your cells. And I can't really speak to the more deeper spiritual side in terms of having someone else's flashbacks necessarily, but the benefit of the exosomes would be to help avoid that DNA. You get the signaling factors, the growth factors, the anti-inflammatory factors that put the cells back in the proper mode of healing and restoration and regeneration without sharing the DNA. So that's always good. So in terms of downside, having talked about this nuance, we haven't seen long-standing problems in the literature from stem cells delivered directly, and we certainly haven't regarding exosomes delivered directly from donors. Now, having said that, I only work with products that come from donors who have not been vaccinated. And it's not a political statement, although I could make one. I don't want to be buried in the desert quite yet.
Yeah, I know. We welcome all viewpoints here at Make America Healthy.
So the reason is we just don't know enough about what the long-term benefits, detriments are from the vaccination and from COVID infections. We do know COVID was highly inflammatory, and we see patients with problems residual, whether it's the disease, the vaccine, or both. We're still figuring that out.
Let's talk about some of the positive benefits. People who have been able to avoid having a back surgery or a knee surgery due to stem cells. We have someone at YogaFit who works for us. She's very young and she's got hers in her discs L4, L5, L6, and she's considering back surgery. She's not even 25 years old. And my first statement to her was, have you considered stem cells?
Good for you. Yes. This is the reason why I went into regenerative medicine after practicing traditional spinal medicine and surgery for over 20 years. And I still do some traditional spine things, but I wanted to add regenerative medicine as a tool for the very same reason you're mentioning it now. There's a large gap between what we have offered traditionally, therapies, anti-inflammatories, maybe some injections, through surgery. Surgery is a big step, and what we're doing surgically hasn't changed drastically in 50 or 60 years. Yes, there are a few new ways to approach it, a few new gadgets or bells and whistles in the broad spectrum. There's nothing new about spine surgery, really. So having said that, I jumped back into stem cell medicine, retrained, and add that to my practice, and it's expanded. Now I'm almost doing only that, which is wonderful. So I help people to the extent that I can delay or avoid surgery by tricking or encouraging their own cells in their own body to tap back into that youthful healing ability they had when they were much younger. It's a low-hanging fruit, Beth. This is people who have, let's say, a problematic knee or problematic vertebra or joint, and we're very specific and precise. We look at what they've done, what they've tried. We make sure that their body is receptive, that they're doing all the other epigenetic lifestyle pieces, supplements, diet, breath work, everything before we do this, because we want their bodies to have the best result. And then based on the work out of Europe, specifically Dr. Philippe Hernigot, published over 15-year follow-up of injecting stem cells into knees, and his results are quite excellent. He's been able to significantly and substantially reduce the need for knee replacement surgeries in a group of patients in his study that were already recommended knee replacements. So they're already bad enough with osteoarthritis, bone on bone, wear and tear cartilage, to reverse their problem, to help them prevent surgery, return to function, and reduce pain. And he's shown that with stem cells. He just published his 15-year follow-up a few years ago, and we're waiting for the 20-year study. Over 80% of those patients continued good success. And that's what we're seeing here in our own practice. Now, I don't have 15-year follow-up yet, but we're doing all kinds of joints and spine work, and we'll call these musculoskeletal parts. And we have shown in some cases where we've done an MRI after the fact to compare to one we've done before, where we do the targeting, that we've shown increased thickness in some cases of the cartilage that had been wearing and tearing. So
that's amazing.
Yeah, we can help people heal their own joint. It's great. We just have to give them a little encouragement. Now, I'm using exosomes for the reasons I stated instead of stem cells, but these are stem cell derived exosomes from the donors. So we have happily very good results, and I'm doing more and more of this, and I love it.
So what I'm understanding from you is if someone chooses the route of an exosome, they don't have to worry. The person who donated this, was there a history of cancer in their family? Is there something, and I don't know if MS or ALS is something that is in one's genetic code, Parkinson's. They don't have to worry about these type of problems.
A lot of these diseases of inflammation, like MS and Parkinson's, aren't necessarily genetic diseases, meaning it's not a DNA based. So
Right.
even if you got someone else's DNA, that's probably not the issue. So the issue is the epigenetics. What genes sitting there in your blueprint are called upon to be utilized to influence the cell activity? And that's where we tap back into these, we'll call them rather naive stem cell-based exosomes. If they have any DNA, it's a few microfragments, nothing more than you get with talking next to someone. But mostly they have these heat shock proteins and survival proteins and anti-inflammatory growth factors. You've probably heard, or maybe you've done a podcast already on the health benefits of Finnish sauna.
Yes, of course. And in fact, I
Okay.
just saw something from, I'm not sure if it was Dr. Mercola, that said really sauna is one of the best ways to detox.
Oh, 100%.
To detox the body. Personally, I use a PEMF mat. I use a lot of red light therapy. I have some friends with biochargers that are supposed to be amazing also at repairing tissue. So my next question to you is, outside of stem cells or exosomes, are there any natural ways that people can fire up the positive cell signaling?
Yes. So breath work, proper sleep hygiene, stretching, yoga has been shown scientifically to increase the number of circulating stem cells in your body. Anything that has an anti-inflammatory cell capacity will also improve the activity of the stem cells. Also, proper diet, nutrition, supplementation.
Yeah, let me ask you about supplements because I take 1,000 of them every day.
Same.
There's that TA65 product. I took it for a while. It was rather expensive, and who knows if it's working or not to increase your telomere length. Are there supplements that we can take? Obviously, fish oil reduces inflammation, but are there things that we can be taking to make our stem cells better functioning?
Anything we take for our own cells affects our stem cells. So it's ubiquitous and across the board. Stem supplements, you normally don't feel a difference. We're taking them to fill a nutritional gap that our food source just doesn't supply, unless you're eating organic fruits and vegetables all day long, every day from diverse places in the world. It's just difficult. So we take these things because they're leached out of our diet. They're leached out of the source that if you eat meat, the animals feed upon, and we just don't get them. We have to fill that gap. There are some blood tests you can do and markers you can do to see the difference, but you may not feel the difference is measured in decades. and the one way you might be able to measure it is through what are called biological age tests, where you study things like telomere length and DNA methylation and glycanation, glycan age tests, things like that. And we do that for people at different junctures because the only way to measure biological age is to look at these accumulated cell damage markers or accumulated cell junk markers.
So if I were to send my mother, who's in her 80s, to you for just anti-aging purposes, do you treat older people to help them retain their youth and really work on their health span versus their lifespan?
Absolutely. Health span is the reason. Lifespan alone is not. Yes, we have many octogenarians that come in for IV. Before we do any treatments, we want to make sure they're hitting all the topics: diet, supplement, weight-bearing exercise, maintaining muscle mass and bone density.
And let's talk about the importance of that. We had someone on recently about mitochondria,
Big fan.
touting the benefits of strength training as a way to improve mitochondrial function.
Not only mitochondrial function, use of your muscles will preserve you and improve your health span, reduce risk of dementia, preserve your stem cell activity, because when you move, your muscles release myokines, which are signaling factors that affect your brain and the rest of your tissues, even your stem cells. And it has to be weight bearing. If you get on a cycle and you bicycle, that's great for your heart and lungs, but it's not really doing as much for your muscles because it's not resistant. So you got to either use resistance bands or weights or walking or what have you, or Pilates, for example. And then when you stimulate your muscles, you're stimulating and stressing your bones and you're improving your bone density, which I want to come back to in 1 second. But why improve your bone density? Not only to diminish the risk of fracture and frailty in the elderly, but you're preserving your most important bank of reserve stem cells in your bone marrow. If you lose your bone density, if you're osteoporotic, you probably have very little stem cell activity. So move your muscles, support your bones, improve your bone density. Now, bone density requires 3 main ingredients. We already talked about weight-bearing exercise. You must have vitamin D3. We can talk about that if you need. And third, you must have optimal hormone maintenance. If you're in menopause and you're not replaced on hormones, you will not make loss of bone mass. Osteoporosis is not a low calcium problem. Giving you calcium and some of these medications to force calcium into your bone is not going to work unless you have all the other ingredients. Most people with loss of bone mass have normal calcium levels. Taking calcium supplements is not going to give them bone mass.
Right. Really, the only thing to do to get bone mass is to hit the weights and hit them hard. We have had a lot of shows on hormone health, and I'm a huge fan of baseline testing. And I also work with clients privately for some health coaching. You probably wouldn't be surprised, but there's so many doctors that will refuse to give women who are past menopause hormone replacement because they're like, doesn't matter. And not to get too personal, but I will, because that's what I do on Make America Healthy. I've been on hormone replacement for a few years. I'm in my mid 50s and I still get a monthly cycle. I have not hit menopause and I keep thinking it's coming, but I'm sure it is one day, but so far it's not in sight. So
you're supporting your longevity and your health span by doing that. Not only the hormones.
Standing on my head is also very helpful. It's amazing. And the woman who's one of our trainers who's doing the longevity program with me, she is 58 years old and she gets her monthly cycle still.
Fantastic.
So we know what we're doing.
Yes, you do. And hormone optimization is helping to preserve your youth and preserve your survival. The longer you're having cycles, your body must do what it can to survive youthfully. Right? It thinks it needs to be fertile, even though you may not be desiring that. It'll preserve that youthful life longer. You're preserving your longevity and health span by doing that. And yes, you can take someone who's been already menopausal, and not just for the symptoms of going through menopause, but to improve their cellular health, their bone density, reduce cardiovascular risk, even reduce dementia by preserving the youthful hormone status. And this has been largely mythologized, and most doctors, they just say menopause is natural, you'll just go through it, and so it doesn't matter. You're right. Am I surprised about that? I'm surprised because it's not a healthy thing to let people just do that. I'm not surprised because so many people have just done what they learned in medical school. They've consumed the Kool-Aid and they just do the cookbook, what the health insurance will cover type of thing.
Yeah, and it is so unfortunate. And that's one of the reasons why I'm so passionate about this podcast, Make America Healthy. Just to go in and blindly trust a doctor, even if you get a diagnosis, without doing your homework and educating yourself. Go to YouTube University and listen to as many different things as possible.
Yes.
Get different viewpoints.
Yes.
Try different things. We had a woman on a few weeks ago who was not a doctor, but she has been a clinician working with hormone doctors for over 30 years. Her answer was high dose estrogen for women. Now, I'm dosed with testosterone. And her take was, don't give women male hormones. And then I said to her, I'm open. I would try something. I use my body as a guinea pig.
We all do every day.
Some people more than others.
Fair.
So I thought, what she's saying sounds great. Maybe I should try this. I said, what are some of the effects going to be? Because she said, you're going to be so calm. And we actually didn't air the episode because for the first time we've done an episode, I thought it might be a little too controversial. So we had her back on with a functional medicine doctor so we could get both sides of the fence. I said to her, maybe I'll try what you're suggesting. I went to my functional medicine doctor. He was like, that woman's crazy. And I would never do that because there are some cancers that are estrogen dominant. She lost me at the fact that I was going to gain weight by doing this.
Actually, I must mention this based on what you're telling me. There may be some truth in what she's saying because decades ago, high dose estrogen was a treatment for breast cancer and a successful one at that. Why did it phase away? Two reasons. One, patients got significantly bloated, which could be the weight gain.
Yeah.
Secondly, the Women's Health Initiative came in and fooled everybody. And that's a lot of reasons why.
Study in the 1980s that made everyone deathly afraid of estrogen replacement.
Yep. That's why I said fooled. And we're over that now, but so many doctors haven't gotten the memo.
And it's amazing how many functional medicine doctors haven't gotten the memo too. If you're listening to this show, if you're coming up around menopause or perimenopause, or even if you've been through menopause, please make sure to get your hormones tested and then read by someone who you feel really understands and knows. And
it will take you 10 doctors to find that person, though.
That is a very difficult proposition. A lot of times people, women in particular, are diagnosed with depression when it's really an underlying hormone issue, also a microbiome issue. Let's tailspin this into sexual wellness too and stem cells, because in fact, Ben Greenfield talked about getting stem cells injected into his penis. And I know people have had O shots and all of that. So let's talk about sexual wellness, because I have several friends that are pharmacists who said Viagra prescriptions are on the increase for younger and younger men.
Yes.
A lot of women have this broken ovary syndrome. Reproductive health is going downward, but
we still want the sexual health component. So
let's talk about sexual health.
Right. Yeah. 100%. Ben is correct. And I think I saw that broadcast, but he and others benefit from, we call them P shots. And it's very simple. It takes just a few minutes to do. And men across the board report improved sensitivity, improved firmness, blood flow, enjoyment, and we're happy with that. And that can last months and months at a time. Of course, we do like them to also use a Phoenix device if they have a vascular problem to break up. It's basically a little ultrasound device. It's called a shockwave device. It's similar to something called lithotripsy. If you've ever heard, you've got a kidney stone and you go in and this big machine sends sound waves through your flank to break up the kidney stone in your kidney and dissolve into little pieces. They have a little mini version called the Phoenix device, like the city, and you can purchase this online and get it at home, and you use it, I think, 30 minutes a day. on your penis, and it helps the blood flow there as well. So the combination of those things helps the man. And then for the ladies, the O shots is a simple procedure, a couple places done in the perineum, and also stimulates lubrication and the cells that deal with sensitivity and pleasure and engorgement and arousal. And that's common now too. Those started out from PRP, then stem cells, and now we can do exosomes.
Wonderful. So, as we move towards the close of the show, I want to come to your clinic after speaking with you today. But if people can't make it to Henderson, Nevada, how do they find a reputable stem cell doctor?
Go to your browser, whatever you use, and search online. I would use the words regenerative medicine as opposed to just stem cell, because there's so many different forms of stem cell medicine now. And search your area and get a few opinions, do your homework. You don't need to leave the country.
I've had friends go to Panama too.
Yeah, of course you can, but you don't have to. Check the credentials, the reviews, see what they're up to and what they're doing, and get a feel for it. Ask good questions. We love people with lots of good questions that have done their homework, and get multiple opinions. As with anything these days, you should be a good consumer. We can't advertise because the FDA has not yet approved for marketing claims these things. So we can't advertise too much. So you won't see a lot of advertisements. We can't make any claims that we're curing anything or treating a disease.
Listen, at least they're still allowing you to practice, because as we know, there's a lot of peptides that have recently been banned. But at the same time, I'll go to my doctor and he's, hey, how about a tetanus and a flu shot?
Yeah.
No, you can't take peptides.
Yes,
We're
yeah.
not supported in a society that wants us to be healthy.
No, and also it's money driven, right? Big pharma's got their toes and stuff. They've put billions into medications. They need to go through the cycle first. They need to have the disease and the cure.
Yeah.
Yeah. So that's part of this industrial sick care complex that we have here. We can talk about peptides. I do recommend certain peptides. We can't prescribe them. They've prevented that, but they are not allowed to break into what's called the doctor-patient relationship. As long as we give you the pros and cons, what we know, everything we do is based on good scientific literature, mostly out of other countries, Asia and Europe, but still, we're not just shooting from the hip. And at the end of the day, the patient gets to make the final decision. And I'm a patient too. I do the IV exosomes 4 times a year. I do the scalp procedures. We do all kinds of different things.
Wonderful. Dr. Jeffrey Gross, thank you so much for being on Make America Healthy. Please tell our listeners where they can find you. And I believe you have a special code for the Make America Healthy listeners who want to find themselves in Henderson, Nevada to go to ReCELLebrate.
Thank you so much for having me. And our business name is ReCELLebrate because we are celebrating the renewal of your cells. You can find us with that name on the web. We have a website of that name, Instagram, TikTok, Facebook, LinkedIn, Pinterest. Just type that in. You'll find us everywhere. And you can contact us. And we love to start our consultations remotely by Zoom, just like this, or telemedicine. So you don't have to come to Henderson unless we decide you want to come to Henderson. So we also have some new partners on the East Coast. So just talk with us and we will happily refer you if you're not in our area.
Wonderful.
Beth, I'm sorry to interrupt the code. Please tell my staff when you call Healthy24 is the code that you heard us on the Beth Shaw's podcast, Make America Healthy, and we will have a special discount for you.
Thank you so much. We'd like to thank our show sponsors, Life Boost Coffee, making clean, organic, mold-free coffee that is shade-grown, and they pay their farmers an equitable wage. Check out my new mindfulness blend of half-cap dark roast at lifeboostcoffee.com. You can save 15% at checkout by using the code YogaFit. We'd also like to thank our title sponsor, YogaFit Training Systems Worldwide, the leader in yoga, mind, body, fitness education. We have worldwide, online, virtual, live conferences. We've got a great conference coming up where I'll be debuting our longevity program, and that will be in Scottsdale, Arizona in the beginning of July. We've also got a conference in Orlando, Florida. So go to yogafit.com, whether you want to teach yoga or just learn how to take care of your back. We've got a program for you. We've got over 250 different programs. That's yogafit.com. And if you enjoyed this show, we really appreciate you sharing it, Thank you, Dr. Gross, for educating us about stem cells and exosomes. Have a beautiful day, everyone. Namaste.